Today, we're taking a closer look at a really interesting career shift within healthcare. We're talking about moving to remote work, specifically this growing area called healthcare data abstraction. So our mission here is to unpack what we found from a source that focuses on, well, training and staffing for these roles.
Yeah.
We want to show how you, if you're a healthcare professional, might be able to use your skills for these remote opportunities.
Yeah, and this is really timely, for anyone in healthcare maybe feeling a bit burned out or just looking for more flexibility, or maybe wanting a different path that's not direct clinical work. This deep dive could, well, shed some light on a niche that's really in demand. High demand, good pay. And crucially, the source we looked at outlines a way to get started without a huge financial risk upfront.
Right. That low-risk part sounds pretty appealing. So let's dig into why this is catching on. The source calls data abstraction maybe the #1 remote healthcare career right now. And the benefits they list are pretty compelling. First off, pay. They're talking $45 to $75 an hour.
That's a significant range.
Definitely. And it's not just a flash in the pan, right? They're projecting like over 100,000 job openings by 2030.
Which really reflects that shift in healthcare towards, data, quality improvement, value-based care. It all needs good data.
Exactly. But here's the real kicker for a lot of people listening, I bet. 80% of these jobs, remote.
80%. That's a massive level of flexibility.
So what is data abstraction actually? It sounds maybe a bit vague.
Well, it's actually quite specific but broad in scope, if that makes sense. The source lists a whole range of areas. You're working with data from medical registries, things like cardiac, stroke, pediatric, heart failure.
Okay, so specialized medical areas.
Right. And also surgical registries, bariatric surgery, vascular transplants, think cancer registry, NCDR for cardiology, STS for thoracic surgery, MBSSQIP, NSQIP, lots of acronyms.
So you're pulling key info from patient records for these big national databases.
Pretty much. It's about standardizing complex medical info for quality tracking, for research, making sure standards are met. It's vital stuff.
Okay, so if you're listening and thinking, this sounds interesting, maybe less stressful than my current role, how do you even break into something so specialized? Our source lays out what seems like a clear path. They call it how it works. Just 3 steps. Learn, certify, get hired.
Yeah, seems simple on the surface. Learn means taking specific courses for the registry you want to work with.
Got it.
Then certify. This involves practicing with mock charts, like realistic case scenarios and taking quizzes. They mention using question banks for this part.
Question banks.
Okay.
So practical prep.
Exactly. And the final step, get hired, involves joining their staffing pipeline and job board.
Let's talk about that training aspect. Why choose one program over another? What makes this source's approach stand out?
Good question. They highlight a few things. First, the curriculum is based on official data dictionaries.
Which means?
It means you're learning precisely what the industry standards are, what hospitals actually need. It's relevant.
Okay, that's important.
They also claim it's one of the first courses out there with these question banks we mentioned for really practical certification prep.
Right.
But honestly, the most eye-catching part, it's this built-in job placement pipeline. And here's the key bit. They say it's a free service if they successfully place you in a job.
Wait, so the training could essentially be free?
If you get placed through their service, yes, that's the hook. It really lowers that initial financial barrier, takes away a lot of the risk.
That staffing pipeline. That sounds like more than just a job board then.
It implies they have actual relationships, yeah. Connections with hospitals, with remote data abstraction companies, the ones actually hiring.
So it's not just get trained and good luck.
Seems like it's designed to bridge that gap. You finish the training, and there's a direct route, potentially, into the jobs they know are open. It streamlines the whole thing.
So when you put it all together,
Yeah.
the demand for remote roles, the specific training needed.
It makes you think, doesn't it? How could a structured path like this, especially with that kind of free if placed model, how could that change your career outlook? It sort of redefines what a healthcare career can even look like, moving from maybe direct patient care to this crucial role in managing data.
Definitely food for thought.
Yeah.
So if you are that healthcare professional looking for flexibility, maybe a change of pace, and the chance to work remotely, this kind of focused training and placement pathway might be worth exploring. It could genuinely be the next step in your career transformation.